maybe 100 at the max for getting your teeth cleaned. Perhaps you get that yearly x-ray. You know, when you go to the dentist, that's what I'm talking about, getting those teeth and making sure everything's clean because you're a little bit lame about using the floss and whatnot. Well, if you're one of those people who's on again, off again with your teeth cleaning, especially with the flossing thing, right? It could really cost you in the end, and so many people, because of the downturn in the economy, have decided that they're not going to pay for the teeth cleaning. So this year is actually shaping up to be one of the worst, they say, since 2005. In the first 9 months of 2011, dentists reported an average of a 3% decline in revenue and profit. Folks, if you don't go to the dentist, trust me, only one time in my life, and I have good teeth, did I not go to the dentist for a short period of time. It was almost like an afterthought. And those deep cleanings, you don't want to get a deep cleaning, I promise you, no matter how gentle the dentist is. So what is up with that? Dr. Mojan Safavi joins us now. She is a dentist extraordinaire, and she can break it all down for us. Hey, Doc, thanks so much for coming on America Tonight.
Thank you for having me, Kate.
So, are you finding that? I mean, before we get into the whole thing about, because I know people have fears about dentists, then there's people who just don't want to say, oh, well, $85, I can save that $85. Have you found that there is a decline? Is that true?
Absolutely, yes. There has been a decline, you know. Visits to a dentist has never been a favorite activity for anybody. But we've been seeing these days with the news in the economy and with the unemployment, some people have lost their dental benefits and they are putting off going to the dentist. And we are also seeing a drop in dental visits of people who are employed and have dental insurance, but with all the news, people are not investing in their dental health. And as a result, we see a lot more dental emergency visits that could have been prevented if the person could have kept up with their every 6 months preventive care appointment.
Yeah, so let me ask you that. So that's the thing. I said the 85 to maybe 100. Let's say it's 85, somewhere in that ballpark. So you decide, I'm not going to do it. I can't afford it. Geez, the economy, I'm worried. I'll just wait. My teeth are good. What can it end up costing you ultimately if you have some kind of an emergency or, like I said, deep cleaning?
Yeah, deep cleaning, it can be potentially very, very expensive. It can be about $1,000, and then you're going to need antibiotic therapy in some cases. But the most important thing is that cavity formation is a process. There are some new technologies these days in the market that if the cavity is caught at an early stage, we can basically stop the progression of these non-cavitated cavities with the use of new products in the market. It's just like a fine crack in your car's windshield. When you catch it early enough, then you can apply a liquid to stop it, and so it will, prevent you from replacing your whole windshield. Same thing with the cavity. If you don't stop it during the, at the right time, then it can cost you potentially thousands of dollars. Then you're looking into doing root canals, crowns, and, all these other procedures that potentially can be stopped if you keep up with your every 6 month visit.
Yeah, because you've been a dentist, so you see this. It has to be a little frustrating to you because you think of what money people pump into other things, like whether it's cars or something else. And I'm not saying you don't need cars or transportation, but where you see people will gladly spend money on other things, but not do it on their teeth for some reason, and then ultimately it costs them the most. And you know this better than I. I've talked to several doctors about this, not even dentists, that so much can happen through the mouth where you can pick up diseases. Things can happen that can almost lead to your death at times.
Absolutely. The basically periodontal disease or gum disease can basically affect your systemic overall health. And it can create, vascular disease. It can cause heart disease because there's a specific bacteria that usually lives inside the pocket of teeth between the teeth and the gum tissue. And if you do not get that bacteria out, this bacteria can basically travel through your bloodstream, not only scarring and damaging the vessels and causing the thickening of the vessels, causing actually atherosclerosis, but it can also go into your heart, damaging the heart muscle. So it is extremely important for people to realize how important it is to do your cleaning, visit your dentist every 6 months, and floss. Of course, you want to floss every night. So that's the key, basically, for prevention.
Right. But see, it's like I said, and this is really a true story. I'm sure I'm telling everyone this in America, but I do have really good, Doc, I have really good teeth. Luckily, I was blessed with good teeth, but doing the flossing thing and everything, but I forget why it was. I had a job transfer. It wasn't so much about the cleaning. It was just that it sort of was an afterthought. Like I said, I don't know why, because I'd always been so good about that, and I had to do that deep cleaning, and let me tell you, when I was in the chair, it was fine. It just takes a long time, but boy, my mouth was throbbing afterwards, and all because if I had just kept up with the 6 months, I never would have had to have that.
Right.
Because it's like you have to explain to people, and you just did there when you're talking about the cavities and the fact that now there's amazing treatments for it where you can catch it almost like a windshield that has a crack. That was a great description. Well, the same thing when you get plaque. I mean, describe what plaque is. You got to get in there and scrape it, right? And it just grows.
Right. You have to scrape it, and the attachment from the gum tissue to the tooth is being lost usually by the bacteria that basically hides inside those pockets. So you really need to scrape it off, and to treat those bacteria, we usually prescribe a medication. It's a mouth rinse medication. It's called chlorhexidine, which we put the patient on it for about 3 weeks to basically kill that bacteria, so the gum can start hugging back the tooth and eliminate those pockets. If those pockets get bigger and bigger, then even scraping is not enough. You have to place antibiotics inside the socket or inside those pockets to eliminate those pockets. So it can potentially become much more than $1,000.
Oh, absolutely. Absolutely. The more neglect, like anything else. I mean, it is like a car in a sense, because if you never put oil in your car, you never took care of your car, you never rotated the tires, then eventually you probably would suffer monetary damage, but at least you hope, it wouldn't be anything debilitating to your body, but that can happen with teeth. What made you decide to become a dentist, a profession where a lot of people just rear back and say, I don't like dentists, I can't stand the drill, I can't go into the chair? You sound like such a personable person, which I'm not saying I have friends that are dentists, but what made you decide to go into this field?
Well, to begin with, actually, I was an artist. I could draw very well, and I had people in dental field, dental student friends, and I was good at sciences, and I was thinking, what am I going to do with the rest of my life? And then finally somebody said, what about dentistry? It is a combination of art and science. So basically that's what caused me to look into dentistry. Wow.
And you never looked back? You don't regret it?
Not at all. This is the only thing that I would, I can never imagine myself doing anything else. I love it, and it's just, it's the right thing for me. So I cannot imagine myself doing anything else.
Who's easier to treat? Is it the young kids that you would see, or the older people, or in between? Who are the better patients? I'm wondering if it's kids.
I would say in between are the best. Children are a little bit, they're a little bit challenging to work on, and you want to make sure that they're possibly sedated and comfortable enough to work on kids. Of course, majority of adults, they're great. So, but we also use, IV sedation these days. There are so many different things for people who are apprehensive, which usually they had bad dental experiences at some point, usually in their childhood. We use different techniques to make them relax, by using IV sedation or conscious sedation or laughing gas. We also use some audiovisual devices such as TV or iPod to get their minds off of the drill. So
that helps. Yeah, here's my question, Doc. When are they going to do something about the X-rays where you have to bite down? That is so awkward when you're trying to bite down and they take the picture of your teeth.
The new technologies there are out there. There are some sensors that are a little bit easier to use, and they are digital, so it potentially exposes the person to 90% less radiation. That's what we use in our office. So you want to make sure whoever you see, they are on top of the new technology and they know what the new products are out there.
Okay, here's the best question of all, because this is my thing with dentists. Do I get anything free, any free dentist swag if I go to your office? Do I get like a free toothbrush?
Absolutely, yes. You get a free goodie bag. We give out goodie bags to everybody. So.
I love that. Dr. Safavi, thanks so much for shedding some light on dentistry and why it is so important to just go get the cleaning. Listen, I'm the walking example of that. Doc, thanks. We appreciate it.
Thank you so much, Kate.